So, based on the findings, we can confirm our hypothesis. The women tend to view mental health as more important and are more proactive in seeking for help. 70% of the women sought for help, while just 20% of the males sought for help. This highlights what a big gap there is between men and women. So, moreover, women reported higher comfort level of talking about mental health and are more likely to use effective coping strategies for coping with mental health, like journaling, therapy. But in contrast, men often relied more on avoidant behavior and of substance use. This shows how traditional gender norms still strongly shape how people respond to mental health. And also, it shows inconsistent with previous empirical studies. Interestingly, while women reported more frequent emotional struggles, they also are better in coping with them and finding strategies. While men have this image to be more strong and self-reliant, even if they know how important mental health is, they will be less likely to seek for help. So in terms of implications, our results underline the need for more gender-sensitive mental health interventions. For example, education campaigns can focus on reframing help-seeking as a strength and not as a weakness, and especially for men. Additionally, workplaces and schools could offer more resources and normalize open conversation about well-being. This approach could help reduce stigma and make it easier for people to access and care when they need it. But furthermore, mental health services should become more accessible and inclusive. Many participants indicated that affordability, diversity among professionals, and easy appointment scheduling will make it more likely for them to seek for help. So these improvements are essential to ensure that support reaches people from all backgrounds and genders. However, it's important also to note some limitations of our studies. The sample size was modest with more female participants, which could also create more bias. And in addition, distributing the survey via WhatsApp might have limited participants to certain age groups or cultures, which affects how generalizable the results are. Even if we did have results from all over the world, it wasn't really balanced. And finally, we have several suggestions for future research. So larger and more balanced samples could help validate these findings. And moreover, it will be valuable to explore how other factors such as race, socioeconomic status, or age interact with gender in shaping mental health perceptions and behaviors. Because age could also be a difference, like old generation are more used to ignore mental health. And longitudinal studies could also track whether attitudes continue to change over time, especially as mental health becomes a more prominent topic and especially also in public discussions. So in conclusions, a study shows that while progress has been made, gender differences in mental health attitudes and experiences remain significant. Addressing these gaps will require targeted, culturally sensitive approaches that make mental health care more accessible and acceptable and effective for everyone.